All right. Hello. I just wanted to thank you, Dr. Love, for joining me today for the GNSA Liaison interview. Um, we're calling from University of Florida. This is a fully online program. So Dr. Love is joining us, and I'm in Naples, Florida. So she's been kind enough to do this via Zoom. So good morning. Thank you for joining.
Good morning. How are you? Thanks for the opportunity to talk about this. I want to make just one kind of tweak, if you don't mind. So online for MSN to DNP, BSN to DNP, it's a hybrid program. So I actually have to come to campus throughout their time when they're here in the program. So we have a couple of different options whenever we're running the programs.
Oh, wonderful.
Yeah,
Good to know. I'm in the fully online MSN to DMP
I
program.
know.
So, please tell us what your title is.
Yeah, thank you. So my title is Associate Dean for Academic Affairs for Graduate Clinical Education. So that means basically I'm over all of the DNP tracks and any degrees that come from that program. I work from students that are admitted to graduation. And in our program, we have about, right now, today, because it changes like every semester, but about 350 students. And we have five tracks that we run for BSN to DNP. So we have family nurse practitioners, psych mental health nurse practitioners, adult gero acute care nurse practitioners, peds primary care, and then peds acute care. And then we also have MSN to DNP, which you're most familiar with.
That's a lot of different programs to oversee. Can you tell us about your nursing research and career and what led you to the current position you're in now?
Yes. Okay. So it's been a career, more than a few days, right? So I originally started with my BSN. And quite honestly, I went into what I thought I was going to enjoy, which was pediatrics in the hospital, so acute care setting. And after about 6 months, I realized, whoop, wait, this one probably wasn't where I needed to be. So I ended up after that time, I had a faculty member that called me and said, "Hey, we've got a position open in the psych hospital. Would you like to come and work here till you figure out what you want to do?" And I did, and I fell in love with it. And I have been in psych world ever since then, honestly. So about 10 years after my BSN, I went back and got my MSN, my nurse practitioner. Actually, at that time, psych mental health was a clinical nurse specialist. So they were just making that transition to help us move into nurse practitioners. I went ahead and took those courses to be able to sit for the exam. They also had, so this is the history, right, of everything. We could either specialize in adults or we could specialize in children. And I went the adult route. Eventually, I went back to school and put it all together so I can now practice across the lifespan. After about another 10 years, I went back and got my DNP. So that's whenever the DNP started coming out. I was the first graduating group from Vanderbilt in 2010, whenever they started their program. So after that time, actually during that time, I think I realized when I was in the middle of my DNP, like I really love this. I'm so glad I started it. But the population that I was working with, which is I've always worked with vulnerable populations, underserved populations. At that time, I was working with women coming out of prostitution and addiction. And there just wasn't a lot of research on treatment and how to help support them. And so I was like, I really want to go back and get my PhD now. So I did at the University of Arizona, where they allowed me to have some credits, right, for the DNP, the courses that I had taken. So I really focused on the research, the stats, the methodologies. And so working with that population of women was really how my scholarship was built. After that time, I moved to Arizona and moved into more of an administrative role. So at that point in time, I was DNP director. Loved it. Loved I call it my midlife adventure going to Arizona. And because I'm from the South, if you can't tell by the accent, I decided I really needed some trees and grass again. So came back to Florida in 2020, and that's whenever I accepted the position as the associate dean.
Wow,
So it's around the round and back.
that's awesome. You've seen a little of it all, it sounds like.
Right. Right. And
Okay.
I've taught, I was going to say for a lot of people that are just starting out, I taught as an adjunct faculty member from like 1998 to 2010 before I went into academia full time. So I was precepting, I was doing guest lectures, I was grading the clinical part of the course that I had for my students. So there was that opportunity to kind of transition slowly to fulfill a need for clinical practice, but also for me to have my toe kind of just stepped into academia to see if I was going to like it or not, and if this is what I wanted to do.
Oh, wow. Yeah. No, that's amazing.
So,
Um, well, with your experience, can you tell us what the difference is that you would consider between just an MSN and being a DNP or PhD prepared
yeah,
nurse
yeah.
practitioner?
Absolutely. Yeah. And it kind of, as you go through these programs, you're realizing, oh, okay, now I understand the difference. But when I went and got my MSN, I was a clinical expert on working with my patient in my room. So able to assess, diagnose, treat, right? Evaluate all of that with the patients. When I went back and got the DNP, all of a sudden my world expanded and I began thinking about populations of patients. So no longer was it just that one person
Mm,
sitting in the room, but how can I have an impact on a bigger population, whether it's through leadership or advocacy or any one of those, right? Clinical practice, quality improvement, any one of those areas, there's an opportunity to have a larger impact. Now, the difference between DNP, PhD, so DNP is implementation science, basically. So we're taking all the research, all the best evidence, we're culling through it, and we're seeing, okay, this is what we need to be doing in our practice to improve health outcomes for patients. Research is all about generating new knowledge. So the knowledge that's not there, the evidence, all the gaps, right, and working toward helping build that knowledge that the DNP could then bring into practice. So really they work very nicely together actually. So when you're practicing, you're realizing like, oh, this is great, but I wish I had more information here. Like that's a really nice partnership. If you ever find a PhD and DNP working together collaboratively, amazing.
oh, that you put that so eloquently.
Yeah.
Well, with that, then, with your PhD and DNP, how would you describe your leadership in nursing and the healthcare field
Meaning what
personally?
kind of leader? Is that what you're asking?
How would you say your leadership in your role is
Uh-huh.
helping the healthcare field
Oh, okay. Okay.
and
All
what
right.
you've done research wise, obviously?
Okay. Yeah. So really looking at so how has it helped the field? I think it is like carrying now I'm in a kind of even I teach a couple of classes, but I'm not a full time, right? In the teaching, I'm more an administrative role, right? So, but it's more at this point in time supporting faculty and new faculty and
Mm,
helping mentor them so that so they come with clinical expertise, right? They're still practicing, they're still doing all the things that they bring into the clinic, into the role in academia, but to help them understand and to be able to work within an academic system because it's really a lot different than a clinical setting. So, being able to do that and the research that we're working on right now, actually, we're writing a grant right now to look at. So, with the new competency-based education, it's blowing up our nursing education world. So, we're looking at how can we teach differently than the old pedagogy, which was standing in front of the classroom, being the expert in everything. Now we're looking at more competencies. So we teach, but then we're expecting students to be able to demonstrate back those competencies. And do they really understand it and can they apply it? So one of the things we're looking at, because UF is well known for its artificial intelligence, so that's like a big piece of what UF does across the university, is how can we bring that into simulation to help students understand not only using virtual reality in simulation, but how can we then apply AI so that they get automatic feedback and they are able to work on skills along the way based on that feedback, that
mm,
it's not a one for everybody that comes into the virtual reality world, but it is based on what you know and what you can demonstrate and what your next step is. So everybody gets individualized feedback and learning at that point in time. So that's what we're working on. We're super excited about it. So hopefully grants funded, and we move forward.
That's awesome and staying ahead of the times, right? I mean,
Brian, yes,
healthcare is
absolutely.
always evolving. Well, what issues do you see in nursing and healthcare where leadership and these advanced degrees are most needed?
Oh my God, policy. I feel like that's really a huge, across the nation, right? Now we have more states than not that have full practice authority. But I can tell you, moving from a state that had full practice authority back to a state that does not is really limiting. Whenever I got there in Arizona, I was able to move into a primary care practice as a psych nurse practitioner, and we collaborated together on patient care. And there were no limitations in collaboration, had to find a physician. It was able to really work. And so I worked with a lot of people that were immigrants that were coming over the border because we were right there at it.
Hmm.
And it really, I feel like you could see an impact. Now I've come back to Florida and I don't qualify for full practice authority, right? And I have to go back and find a collaborating physician to be able to support me in this whole process. And that's difficult. That's really one of those gut-wrenching things, right? After practicing for what, over 30 years now, I'd have to go back and let's find that person. And so that's hard. And I think we really need strong advocates for us to helping us move this forward. Just not for us, but for patients, right? There are patients I know from psych mental health in my world that need to be seen. And there are people that are struggling to get practices and or like me, I've just decided at this point in time I'm going to stay in administration. I'm not going out to be practicing again. Like there are opportunities that are missed because of the limitations that we provided and patients need more. There's just not enough physicians, nurse practitioners and PAs all put together to treat the patients that we have.
So true. And with policy, how would someone in graduate school, like how
Yeah.
would someone look at local, state, and national policy change? How would they get involved?
Oh, that's a great question. A couple of ways. One is that every year we're invited to go up to Day on the Hill, right? So there's in the state. So you can think about Florida. Every January we get invited to go up. And so we have a group of students that go up with us and we meet with legislators. And that is really, I think, just to get a comfort level, right? Of being able to, how do we discuss topics? How do we have conversations with them?
Mhm.
On a bigger picture, specifically for nurse practitioners, the American Association of Nurse Practitioners has every state has opportunities and regions to work together for practice. We have a representative here in the state of Florida. We actually have two representatives, one in North Florida, one in South Florida. And so they together really work hard to work on policy and to help movement and make changes in our state. So being a part of that, an active part of that, not just a member, and they are so excited. Like if they had somebody that said, "Oh, I want to help. Tell me what I can do," they'd be like, "Okay, come on in." They're not discriminating. They don't eliminate people. They're like, "Let's all get together. The more, the merrier."
Wonderful. Has any of your research or healthcare research been made into policy or implemented change within
Mhm.
systems?
Just a minute.
Sorry.
If you have to break that, you can. Let me get one more sip and then we'll go. Sorry, you think allergies wouldn't be bothering me, but they are. So yes, which was interesting because I did a lot of work when I lived in Nashville. Golly, I can't hardly talk now. I did a lot of work when I lived in Nashville, Tennessee with school systems. So they were really good. We had a lot of crisis, just like everywhere else. Like we'd have natural disasters. We had multiple school shootings, and they did a really nice job of like whenever a crisis was occurring, like locking down schools, knowing what to do. But afterwards, they didn't know what to do if a crisis occurred, like with the mental health part of it, right? How do you address student concerns? How do you address faculty issues? So we developed a whole training that was statewide, and we would go across the state and train schools And then also help them, like if something happened, we had a team that would go out to help support them as well. But that was funded through the State Department, and they actually still continue that whole program that was started years ago now because it was so successful. And then we had some policy work that was done with mental health piece of it, specifically with students in the school and how can we help identify and how can we support them. Um, some work around that, and legislators actually endorsed it with school counselors helping support the students. So there was a lot of work around that time done because of the issues that were occurring. So it's fun to see whenever you do something and you've made an impact of how it can actually be ingrained. And these programs were sponsored and also funded by legislators. So if they didn't like it, it was, those are the times when they start like writing drawing the line through it, right? So, but it kept being funded and it still is a great program in Tennessee.
Wow, that's amazing.
Yeah, it's a
Uh,
lot of fun.
no, that to implement and then see such positive change and just advocating for that sensitive patient population of people and
Absolutely.
students. Absolutely. Um, just like as a big final question, I've so appreciated your time. What advice do you have for the next generation of nursing leaders that we all want to follow in your footsteps of amazingness?
Oh, wow. So I personally think the DNP has allowed us to move forward in a way that we have not been able to do before. So, on a personal level, on a professional level, I encourage everybody that has the opportunity to move forward with the DNP. It has made a difference in us being invited to the table, I feel like, on a lot of these issues where before we were not. It has brought us parity along with other providers that are now requiring doctorate degrees, even though nursing hasn't quite got there yet. Others have other specialties. And we're also seeing such complex patients now. I think it just is more than it was when I was in school, right? A long time ago. So I think this is such a need right now for us to, as collectively, as nursing and nurse leaders, to move forward, to get your doctorate degree, and then to take, so step out outside of your. So I would have said policy was not in my wheelhouse when I first graduated from school, but because of opportunities I've had, like president of the International Society of Psychiatric Mental Health Nursing, a lot of policy work in there. So it's taking yourself and being allowed to go outside of your comfort zone and grow, and then finding out when you see the impact of what you're doing, it's super energizing for from personally and professionally to see what's happening. So I say keep going. We got this. Move forward.
Oh. Well, thank you so much for taking the time to share your wisdom and your thoughts and your experiences with us. On behalf of the GNSA,
Oh,
we
that's
thank
very
you so
nice.
much
Thank
for
you.
your time.
Thank you.